We begin with a growing health battle for hockey teams off the ice, the mumps. The virus is benching top players across the NHL.
This is a virus that's spread in droplets, saliva, mucus, so you can spread it if you're infected by talking, by coughing, by sneezing, and in the case of a hockey player, by hip checking somebody into the corner and then maybe yelling something at them. I mean, you have this, you see on TV close up the spits flying.
Right.
So it's not that surprising to see that somebody could get infected that way.
Holly, how do you treat and prevent mumps?
You know, Anthony, there really is no specific treatment for mumps. It's more about supportive care and monitoring for complications like deafness or inflammation in the brain called encephalitis. In terms of prevention, the best way to prevent it is through the vaccine. 2 doses of the vaccine lowers your risk of getting the illness by 88%. The vaccine's given it right around the age of 1, between 12 and 15 months, and also another dose between the ages of 4 and 6. And most people keep that level of immunity throughout their lives. Some people see a drop, but most people don't.
All right. Also this week, memory loss and aging. Up to 20% of Americans over 65 suffer mental lapses. But a large new study offers ways to keep it from happening. Holly, what sort of memory loss are we talking about in this study?
Right, Anthony, this is a very specific type of memory loss. It's called mild cognitive impairment. It's different than dementia. It is, in fact, more mild, and it's far more common. Some of the symptoms are things like being forgetful, forgetting appointments, misplacing things, having trouble finding your words, and of course, all of us experience that. But mild cognitive impairment is more defined by having a persistent change in the amount of these sorts of, moments of forgetfulness that we have. And it's also mostly in people over the age of 65.
So is that sort of the ballpark of when we should start discussing these issues with our doctors?
I actually think you should be discussing them with your doctors all the time. I think, although it's not actually full-blown dementia, it is part of the spectrum and the pathway potentially towards dementia. So I think doctors are a little bit too flip. People come in, they say, I'm having trouble with memory. Now, some things can just be part of normal aging. You see somebody and you know their name, but you can't quite think of their name. And I know that sometimes you'll say something like, look, it's one thing if you can't find your car keys, it's another thing if you find the keys and you don't know what they do. But I think any kind of concern, you talk to your doctor, because there are tests that we can do. There are mini mental exams that we can sort of do in the office. There's more formal cognitive testing. And one of the things that we've learned really is that we really need to be diagnosing dementia much, much earlier so that we can see if some of these new treatments work.
A superbacteria was found in a bay off Rio de Janeiro, site of the 2016 Summer Olympics. That stretch of water will host the sailing and windsurfing races. The bacteria is highly drug resistant. Olympic organizers promise to cut the amount of sewage that flows into the bay.
New research shows yoga may be as good for your heart as certain aerobic workouts. I think my wife planted this story. John, can you tell us about this study?
Well, this is a literature review of 37 randomized controlled studies, almost 3,000 subjects. And the idea was, okay, yoga, you tend to think of it as maybe not all that aerobic. So how does it stack up against true aerobic exercise? And the truth is that it stacks up pretty darn well. There are lots of different types of yoga. Some of them are more aerobic and you do a lot more exertion than others. It is a combination of physical, mental, and spiritual. And what they found was that people who did yoga had a decrease in blood pressure, in pulse, an improvement in their lipids. They lost weight. So clearly there is a role for yoga, and it stacks up pretty well.
Does that mean we should basically ditch our running shoes and pick up yoga mat?
No, not at all, Anthony. Although I am a big Ashtanga yoga fan. I find it to be really aerobic. But the point is just to keep your aerobic exercise. If you're jogging, if you're at spin class, all of those things lower our risk of heart disease. But if you are a couch potato, doing a few vinyasas is probably a good thing.
It can be hard. Some of those poses are really hard to master.
Impossible, yeah.
But it can be relaxing. Well, from deep stretching to deep breathing, if the thought of carrying some extra holiday pounds has you stressed, just exhale. A new study finds more than 80% of fat leaves the body through breathing out. I suddenly want to exhale as I ask you about this story. How does it work?
Right. This was a really interesting write-up in the British Medical Journal. And there's been some controversy about when we lose weight, where exactly does the fat go? And much of the thinking was just that we burn it off and we release it through heat, through thermogenic energy in our body. This study, they did these really complicated calculations and formulas, and they ultimately found that a lot of the remnants of fat we actually breathe out in the form of carbon dioxide.
Oh, wow.
So when we lose fat, we're exhaling it in a way.
What this does not mean is that you should hyperventilate to lose weight.
That's just what I was thinking, John. Dr. Jon LaPook, Dr. Holly Phillips, thanks very much.